just to ask, for his mental health, how was your mental health in sickle cell?
Oh my goodness. I'm gonna be honest. I'm still working on that to get. When I spoke about being, in a peaceful mentality, a peaceful moment. So I'm still working on that because
Hmm.
for a while I used to be angry.
Did you?
I used to be angry. I was a mask it,
Hmm.
a great mask, a smile and everything else. But it was the chronic pain that you wake up to, the things that you wanted to do,
Hmm.
and it's just like, oh, I can't do that.
Hmm.
So, I'm a firm believer of a higher power and things like that or whatever. Like that kept me that I had a balance, but also I used to ask God. I remember in the hospital. Okay, so really, I said I'm this not the nicest person you could ever meet,
Hmm.
and I'm here. Like literally, I remember having this whole fit in a hospital, and they even asked like, did I want a chaplain or somebody to come up to talk to me? I said, bring them.
Right.
I was like, bring them.
Hmm.
So I had this moment of just venting to God. So I also learned
Hmm.
you have to talk this out. You have to pour out and speak to God, your higher power, or whomever, and also talk to a counselor.
Hmm. Very
It's
believable.
okay, but the thing is, with our African American culture, some people be like, "Oh, I ain't
It's
talking to no
taboo.
counselor. I'm cool." Like so making that being a comfortable place to go, so you
Hmm.
can cope, so you're not displacing your stress or your anger or on someone else.
Right.
So basically, I still time to time just like love having things like this interview.
Hmm.
That's like, okay, yeah, cool. I can relate.
Yeah.
Just being able to talk to someone. I remember just because I'm a person that's on the go all the time,
Hmm.
and someone was shocked, like, and I said something about because someone called off for like a code or something, and I laughed, and I'm just like, and then I said something about I having sickle cell, and the girl was like, what? I would never thought.
Hmm.
Yeah. And so, just getting up, going and things like that and working through the chronic pain.
Hmm.
But being able to talk to someone that
Hmm.
can relate and I can see that you're active. You're bringing this whole group stuff together. I love that. So that also helps with people with sickle cell, just having like, okay, somebody out here speaking for us.
Hmm.
So
Yeah.
yeah.
And the reason I asked that because, like I said, I'm 43, and people who fight chronic illness should have a therapist.
Mm-hmm.
I wish somebody would recommend me. Well, let me not say that because I was one of them guys. I ain't talking to no
All right.
therapist. I ain't about to
Mm-hmm.
lay on nobody's couch like I'm about,
Mm-hmm.
you know.
Mm-hmm.
But I used to work out a lot. And when I got to the point where I couldn't work out a lot, not realizing that I was using weights as a means to relieve stress.
Mm-hmm.
But when I got older, and I have quite a few replacements, I wasn't able to work out no more. So I had my first anxiety attack 3 years ago. I was around a lot of death, a whole lot of death. One particular that really got me going for my anxiety was my father. Walked in and he was dead. I had to do CPR. He took his last breath in my mouth, and
Oh my
so that kind of
goodness.
But I didn't realize what that done. But then I mixed that of not dealing with that. But actually, it was back to back. I mean, bodies was just boom, 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 boom. And I was a lot of them I was in the room with, and I ended up mixing a sativa, marijuana.
Mm-hmm.
A sativa is the real light flower, the real bright green flower, right? But I didn't know at the time that sativa triggers anxiety. Even though I have all these health issues and I've been around all these deaths, so all that in that time span, I had my first anxiety attack, and I'm like, damn, I thought I was about to die. It felt like if I would have said I was going to die, I would have did it right there. So I had my cousin. I'm like, man, take me to the hospital. But he ended up taking me to, I said, drop me off at the fire department. I'm like, I ain't got time to go there, put me over here, right? So I did that, came home. I'm like, man, what is that? And then I stopped smoking weed because I didn't know what it was. And I stopped for 30 days, and then I started creeping back, hit one. Then it happened again almost a month to the day. And then after that, I started looking into frequency therapy. Are you familiar with Hertz?
No, I'm not.
So frequency therapy is basically what our EKG is with your heart, that frequency, the line, right? So different hertz, like 720 hertz. It's so many different hertz. So I started doing research on how to clear your subconscious, and that's how I got into stones, colorful, different color glasses that triggers, like, are you familiar with light therapy?
Yes, I am.
So they got these like red glasses, blue, green, etc. So I just started doing my research, because my thing is this: I can deal with sickles. I've been fighting pain all my life. I don't want to lose this, and that's what I was slipping. So I'm like, okay. So I started going to frequency therapy. That worked a little bit. Then I started seeing the therapist for the first time in November of last year, and I'm in the beginning stages with that. Psychiatrist. I got a therapy dog now. Because you see so many people that pass, but then when you see the ones that die from sickle cell, complications of sickle cell, that plays a factor. Because you're getting older, you constantly on your mind, and I found myself thinking about death too much, way too much that I should be doing, and I'm literally in the beginning stages of that now. But that's why I want to know what do you do for your mental health, because we deal with that. I don't know how old you are, what I mean, but the older we get, we not that relentless kid no more. Out there with that, I don't give a F spirit. You get old, you start worrying about things and things like that. So that's why I started this platform too, to help me with that, because this is therapy. Just the fact that you can vibe with someone who can relate, who not looking at you like you cockeyed crazy, and who not looking at you with the little violin like, you just complaining, like,
Oh my goodness, I hate that. I have to stop talking.
Yeah, right, yeah, cause, but it's crucial. But I do recommend therapy. I recommend it to the fullest, and that's just for chronic illness, not growing up in these certain environments, these pockets, not just the inherited mental health issues that you didn't, but we just strictly talking about chronic pain and health issues. But I do recommend that. But I do have a therapy dog named Loyalty, and he's a Boston Terrier. Actually, this him. This is the brand I started for him.
Aw, I love it.
Yeah, True Loyalty. Like,
Yes.
that's his name, Loyalty. And what he provides for me is distraction. My son grown, I'm an empty nester, but he provides distraction. He provides me to walk every day. Even when I don't want to walk, I have to take him out. So them days when I slip into that mental state and I'm sluggish and I'm kicking myself and I'm frustrated because tired of fighting, and he allows me to stay moving enough till I get up out of that mind frame again, versus just being stuck and popping the pill and finding your reasons. But even what you said for his company, like I tell people every day, I can't fight you in sickle cell. If I'm in an unhealthy relationship, I'm getting up out of that. I'm any kind of relationship. If it's stressful, walk away from it. Yeah. So you said a mouthful when you said that. Do you have any kids?
Yes, I have 2 boys.
2 boys. Do they have sickle cell?
They have the trait.
The trait?
Yes.
Okay, I know that's good. Do they experience any?
No discomfort or anything like that.
That's good.
But I do educate them about sickle cell and stuff like that, and in the future, whom their wife's going to be or whoever, just know about the risk factors, and they experience firsthand. They see me going to the hospital and things like that or whatever, so they understand it.
But that's good. My son, he's a carrier too, and he played football, and I didn't want to reveal to him early on about having sickle cell trait, because I knew that I didn't want him to associate what I deal with what he think he might deal with. So I had to wait till he was probably in the 9th grade to actually tell him, but I was behind the scenes with his coaches, like, look, make sure he get his breaks, make sure you stay hydrated, because I did some research years ago. A lot of the college football players died from sickle cell trait, because when you play football, football, they gonna break you to your, they gonna work you to your breaking point.
Exactly.
Which is not healthy, especially when you fight, if you got trait, because, but a lot of patients died. So now it's mandatory. That's why when you see college football games now, you see, Gatorade stands on every corner
Mm-hmm.
because they have to stay dehydrated. Back in the day, it wasn't like that.
Mm-hmm.
You see what I'm saying? So I had to tell him that, because I have met people with sickle cell trait who didn't have surgeries,
Mm-hmm.
who have mimicked some of the same symptoms.
I just recently experienced that, like, from people like, oh yeah, I'm having this. I'm like, really?
Mm-hmm.
Like the aches and stuff like that. So yeah, I just recently heard about that.
Yeah, but see, people with sickle cell trait might misconstrue that I slept wrong or I worked out too hard, but not realizing that's that trait, showing its head. You see what I'm saying? So how old is your little ones again, you say?
I have a 14 and 13-year-old.
14 and 13-year-old. Yeah. That's what's up. That's what's up. But like I said, and that's a good thing because my doctor used to tell me, D'Angelo, you gotta make sure you tell them you got sick. I said, that's pillow talk. Like that ain't no conversation you about to have. When you are having an encounter, that's an after the fact conversation. But I do believe that kids should have that conversation. How realistic it is, I don't know. You know what I mean? So, but by you being a nurse, have you had experience where you had to critique a doctor, a nurse at a visit, just by knowing what you know for, being a nurse and knowing your body and, do you reveal that to them?
More so like when I do go to my physicians, it's from a specialist. So the specialist had already referred me. So they kind of just know like my history. Okay. And I won't go to a primary physician if my specialist has not like channeled them in.
Okay, let them know what time it is.
Yeah. Mm-hmm.
Okay. How long have you been with your doctor?
We actually had a new doctor, so I was heartbroken. So I have a current appointment coming up. Like he actually retired, so I'm nervous. Like, and he was like, he's an old school doc. He no longer he retired, but he was an old school doctor. He knew sickle cell patients like inside out. Like very passionate. Very passionate and things like that. So I haven't met her yet. It's my appointment's next month. I sent out this little goodbye thing. So this is my second goodbye from Children's Hospital. I had Dr. Kelly. I never will forget him. And then now my at Good Sam, he's saying his goodbyes, and so my appointment's next month.
So it's the song and dance all over again.
Man.
That's stressful.
It is stressful.
That's very stressful.
It is because although, the doctors kind of tell them about their patients and stuff like that, but you develop a relationship with your doctor. They can see you walking down the hallway like, okay, so we're going to go ahead and admit you. They can see it. Yeah.
Yeah.
But to have someone that, if we express, the protocol and things like that, now they're looking at you, then that's going to be a loss for us. Like, that's going to be a battle that we have to, like, hey, I'm not addicted. Hey, I'm not this, but this is my protocol. Although it should be in my file, but some people still judge you.
Yeah, and
I am nervous though, to be honest. So.
The reason I asked that because I had a doctor, right? I'm at OHC now, which is in Blue Ash, but I was a patient at UC for years, and I met a doctor. I'm at a point where I really want to blow these doctors' names up, but I don't want to be messy yet. I don't know how they're, you know what I mean? But some of these doctors really do need to, blow their name up. But I had this one doctor, and I have a medical marijuana card. And my doctor, they always knew I smoked weed from time to time before I even had the card because it's a part of pain management. But he come in, found out I had a weed card. He refused before I even met this guy. I ain't laid eyes on him yet. Don't know what he looked like. He don't know. Never met me. You saw my picture, of course. It's in my file. He canceled my talking about, well, I'm not giving him no medication until he forfeit his weed license. So they called me, D'Angelo, you got to forfeit your weed license. He said he ain't give me no medicine. What you mean? It's noted in my chart. I smoke. He canceled it. I had to cancel my card so I get my medicine. So I meet him. He come in, he got an S on his chest. little sharp white guy. He got an ass on his chest. Oh yeah. First thing he say, well, we're gonna make some changes. Your opiate level is such and such, and this, that, and the third. So, but when I interview, he's interviewing me, but it's a two-way street. It's a two-way interview. So I start interviewing him. He didn't like it. I read his old body language because I asked him. I said, okay, you are a doctor that come from over children. You deal with patients in Africa. I said, okay, well, sickle cell patients here is different than Africa, and we not kids. I said, so how long do you plan on staying around? I said, so what happens if you get pushback that you don't like? Are you here to stay? And he looking at me. Yeah, I'm here to stay. Fast forward, he barely show up to clinic now. But
oh wow,
so what he did to me was he came and took a whole script. Now at that time, my regimen was methadone and oxycodone. So I told he say, so which one? I say, well, look, I work off my oxycodones. My methadone allows me to sleep at night, so I can get ready to go to work. I say, so if you're gonna take anything, you take the methadone, because I can't work off the methadone. So it wasn't like I had a choice. They allow you to believe that you are included in your treatment, but you really not. So you can't protest and say, I don't want you to take nothing, because the first time you do a pushback, they're gonna note your chart. Drug seeking. So he took a whole script, went through withdrawal, found myself in the emergency room where I haven't been in 3 years.
Wow.
He set me back.
Yeah.
All because he felt like I can't have, he felt like I shouldn't have a certain medication and marijuana, So these doctors come in and they make these decisions on our lives, without even knowing the patient itself. I try to give him my background on what I do. The social workers try to speak on my behalf. Oh, D'Angelo ain't like that. He this, that, and the third. And he wasn't trying to hear none of that. So, I really wish you luck on your on this new visit.
I know. I'm so nervous. I'm nervous.
So it's sad. But the fact that you were a nurse, you were a nurse for 10 years. You was able to make it through that process to become a nurse while balancing. That should count for something.
Right.
Because don't judge me by the script that I take. Just said that we are being judged by the medication I take. Another question. Have you ever had any surgeries?
I have not.
That's good.
No. Yeah.
That's good. That's real good. Now, how old are you?
I'm 36.
36? Okay. Yeah. I had my first hip replacement at 24.
Wow.
24. I was on a cane and an eye patch at one time. People thought I was trying to be cool. I said, only if you know.
Yeah.
So that's beautiful that you don't. Now, do you take any narcotics on the regular?
No, I do not.
That's good.
So,
that's
like I said, I'm a water drinker. I do my vitamins, the folic acid. So I just try to keep up with that. And like I said, I'm a person, I got my scissors out. I have to have my peace. Like, and they're like, oh my God, you can't be like this in life. Like I said, but you don't know the aftermath. Like, what this can cause for me. Like, and then people I have allowed to cause any type of distress in my life, I just couldn't believe that they even linger that long. So, that's what kept me from, I don't want to say dependent on medication, but that's what kept me away from some of the narcotics. Yeah. Like, because I didn't have any that many flare-ups. But like I was telling you earlier, when I was younger, I didn't know my body. Yeah. I didn't. And so it was like, okay, I'm out of medication. I got to call my doctor, or I'm hospitalized and things like that or whatever. But once you get into that space and it's all about your health.
I do agree. Yeah. I mean, that's valuable, like I said, because my regimen at one point, I was on Oxycontin 80s. That sent me through a depression. Because that's why I try to take as less as possible. My last resort, I would take a 30, chop it in half, and this Petula 15s in my blood carry on, and but I try to recommend them to patients. I met this one lady years ago, and we was at this group meeting, and she was like, "Oh yeah, my Oxycontin, love my Oxycontin," but she got oxygen in her nose. I'm like. And I was just cringing because I don't want to be the one to be like, you shouldn't, do better. But at the same time, I'm like, damn, dependent. Like,
yeah,
you know, they dependent, you know. But I would love to see, what would you love to see for sickle cell patients? Like, what would you love to see for us? Like,
so I mentioned earlier, our advocate at the door. At the door. It hurts so bad to be accused to be a drug addict. And also on the other side, you're serving. I'm a nurse. You're serving the community as for educating, and to be accused when you walk into the door.
Yeah.
To wait in the waiting room for hours, and I'm telling them, longer it takes for me to get back there. Yeah. Because when I was at Children, our protocol, they took us straight to the back.
Grab you by your hand and walk
But
you.
now just to look at you and see you in agony and crying and stuff like that, where's the advocate?
Yeah. They care less now.
Yes.
And it's been like that. For real. I mean, honestly, my opinion, healthcare is trash. You know what I mean? It's even worse now with COVID, since COVID came around. Because now you're doing interviews, doctor's appointment through Zoom. You checking your own blood pressure, hopping on one leg with your thermostat in your mouth. And I paid you this for what now?
Yeah.
Like, you know. Yeah. So, you know, but like I said, you know, what stigma that you would like to clear up that sickle cell patients deal with?
Just like we're constantly talking about the drug abuse. I'm done with it. What
about being lazy? You know, we get the late. We don't want to work. You don't want to do nothing. You don't want to, you know.
And that piggybacks off of when I was telling you about how the individual was shocked on how much I do. You know, also the stigmatism of us having that excuse. Like, so you know, all that needs to be dissolved.
And I think that's why a lot of us don't speak on it, because we don't want to look at it like it's an excuse. You know, when you don't want to say, "Oh man, I don't feel like doing it today, man. My back hurt." You know, "Oh man, you all."
But the thing is, they don't understand how sickle cell fatigue us. We get tired easily, or whatever. But once again, sometimes you don't want to speak on it. You know, I don't want someone to feel sorry for me either. So that's why I kept quiet for so long, where I eventually said, okay, I'm comfortable to talk to the individual on why I can't do this.
Yeah.
Like, it is days, like, I'm asleep.
Yeah.
Like, it's like when I've done so much, yesterday when I crash, I'm sleeping. Yeah. I'm tired.
Yeah. I mean, so how do you balance sickle cell in relationships?
I actually had dated to where sometimes I didn't tell.
Okay.
Sometimes I didn't tell them. Oh my goodness! I think I dated someone that actually commented and made a joke about it, and I sat silently. I was younger. Sat silently about it. Like, now, currently, my past, I want to say, probably the past 10 years, I was more vocal. But from teenager, before 25, I was kind of more silent. I do share it with them. They're like, and it's having groups like you're forming is allowing people to be more aware. Also, then I'll be surprised, like, oh yeah, my cousin got it. I know what, and then it's like, oh, like, you know, so people are more open, and now I'm more comfortable with myself. Like,
right.
Okay, and this is who I am. Like, you know, and so so a lot of people, the guy in the past, they sick a lot. I ain't trying to do. I was just like, well, he just don't know who he got right in front of him. Right. But also, I wasn't even comfortable. Yeah. At the time.
Yeah. Being judged on situations, because I had situations where, you know, I was once married, and a lot of reasons why I had to pull the trigger on the divorce on that, because after a while, like, once again, if it becomes bad for your health, you know, walk away from it. But that's why I want to know, because I just curious on how to balance that, how to balance school, how to balance work, how to balance relationship. That's what 365 Never in a Fight thing came from. It just came from everything that the common denominator is sickle cell. How can I maintain my health while I do and chase other goals and dreams and deal with people in different relationships? So, you know, and that's what we do here. I just try to help people maintain, and we can learn from each other and figure this thing out and, you know, be more advocates. And I'm looking for the day till we can really start blasting some of these doctors out and these nurses and these Because even the pharmaceuticals, the Walgreens, Kroger, all the pharmacists basically, because that's a hurdle just trying to do that. Every aspect of sickle cell is a struggle to try to have some dignity and respect. We just look for the same respect that every other chronic illness get. And we know why we don't get the respect. There's no money in sickle cell. The sickle cell, it affects, people that look like us. Don't get it twisted. Yeah, I know they got Italians and Mexicans and things like that. But I'm looking for the day till I can really sit down with somebody who look white, with sickle cell and see how they be treated.
They're treated.
I ain't found one yet. I'm still looking, but I'm curious. Is they treated the same way? And it would shock me. For some reason, I would bet my little last couple of dollars that they probably not. But I would love to sit with it. But is there anything else you want to put in the air before we get up out of here?
Let's basically move forward on trying to be an advocate in the hospitals. Show up.
Gotta say that.
Show up.
Gotta say.
I don't know how we're gonna get in, but we need to get in.
When I'm thinking about that for real, it should be a number, to where someone can call. And when you in the hospital, even if you just need a visit, like I said, I'm the type of person that I will go see someone because I know how I feel to lay in there by yourself. And that's not fun at all, so it should be, that'd be something else, you talk about on the back end, but it should be that. It should be a number people can call and say, man, I'm over here at such and such. Because sometimes you could be in a pain crisis where you're not even coherent to the point where you're not really hearing everything that's being done and being treated, because I had a port pull years ago. And when they pulled that port, I had a broken needle inside my port. And the doctor was like, yeah, you got a needle in there. I'm like, and I didn't know who to sue or what to do because it had to happen when I was in one of them states. It just goes to show how sneaky, somebody actually broke a needle off, didn't tell me, and left it in there. You see what I'm saying? So things like that, you get mistreated there. Just different things that people need to do, man. And I just look what I want to see for sickle cell is just to get the respect that we do. We ain't asking for much. Get the respect. And it's good for more people to like you, and like me and other people, even people that's celebrities with sickle cell need to speak out more and let people know that you can do things and don't have to be embarrassed. You see what I'm saying? But it's at all time how it is what it is though. But it was a beautiful thing. We're gonna wrap it up. You good? You ain't got nothing else to put in the air?
No, thank you for having me.
Oh, for sure. We're gonna do this again though, because there's so many. We always go deeper and super deep, But my main thing was you being a nurse. I think that was just so cool. Yeah. Just being a nurse and also have sickle cell. I think that's very beautiful just to show that side. And I know what it takes. Well, I don't know what it takes personally, but just imagine all the studying you had to do to get where you. How long did you go to school for?
So basically I was in school for 4 years. So I started from my LPN, or actually I started being an SCNA, LPN RN. So, like I said, I almost been a nurse for 10 years. So. Okay.
That's what's up. So you was at Fortis College when I was
there. I was, and now that I'm like, you're saying your name. I was like, I heard that name before. I was like, I promise you, I do remember him.
yeah. Well, that was cool. We had the blood. It was funny though because I graduated in Oxford. The reason I was able to do all these blood jobs, I used to work for Oxford for 10 years. Okay. And that's what I used to do for Oxford, was speak on sickle cell and coordinate blood drives. I had blood drives over in Hawaiian Village when I stayed over there. I got people money off when they rent. When they donated, I got seen a lot of people who donated the blood drive for this got credit on their credit. Some people who donated, so I was able to pull some things together. And we did one here when we first opened up here. It was beautiful. COVID has slowed a lot of things down. Looking to get back to it, but I really enjoyed doing blood drive. I don't give a fuck no more. Taking that shot, more smoke. Gotta be at work in the morning. I'ma fuck around. We're gonna get up out of here. Once again, this is 365 Never Ending Fight, and we out. Y'all be easy. Keep my business on the low. Call my phone like, Nick, I think you need to take a seat. Don't you say a word.